Welcome to the Arizona Clinical Informatics Educational Series on Cerner Power Chart, Lesson Number 5, Medication History, Part 1. As we begin the coverage on obtaining a medication history, we'll take a different approach so we can better explain the importance of this step in the care of the patient. First, let's discuss iatrogenic events. When a patient acquires a new illness or is injured due to the services provided by a medical provider, that being a physician, a practitioner, or a nurse, the result is considered to be iatrogenic. Iatrogenic events can occur during a diagnosis or treatment. They may cause physical, mental, emotional problems, or in some cases, even death. The key understanding of this event is that a new medical problem has cropped up as a result of the actions of the medical provider. Essentially, it's saying that the patient would not have gotten sick or hurt had they not interfaced with that doctor or practitioner or nurse. An iatrogenic injury is a form of a medical error. As a healthcare professional, these mistakes are never intended, but they are no less harmful to the inpatient. System failures account for the vast majority of medical errors within the hospitals. Almost 80% of all adverse drug events are traceable to a system malfunction. That system malfunction transcends into human error. To err is human. In those errors, they are costly in terms of loss of trust in the healthcare system by patients and also diminished satisfaction with both patients and health professionals. Health professionals pay with a loss of morale and frustration and not being able to provide the best care possible. It is one of the leading triggers for nurses quitting the practice. Patients pay the ultimate price, though, with adverse events, including harmful injury or even death. Studies continue to show that electronic health records make hospitals safer. Yes, we realize that documentation work has increased with the EHR, but almost 2/3 of the nursing population now have never documented on paper. Issues lie with lack of redundancy of previously entered data. Redundancy in health systems are needed to ensure accurate documentation has been completed to prevent any adverse events from occurring. I know redundancy is one of those trigger words in documentation. However, in this instance, we're not talking about the redundancy of repeating the same documentation over and over again. Redundancy here is the practice of double-checking the medication history that greatly reduces any adverse events from occurring. Nurses and pharmacists have to take responsibility for performing this before the reconciling physician reviews the medication history. Omitted, incorrectly entered data, and duplicates in the initial medication history are the leading causes of those iatrogenic events. First encounter staff, whether that is an ER nurse, a floor nurse, or even a surgical nurse, need to understand the potential deadly consequences of not entering a complete and accurate medication history. A second reviewer of medication history needs to involve the patient, family members, pharmacist, and our clinical pharmacist in verifying medication history was entered correctly. Teamwork involves all healthcare professionals, patient and family members, and in some instances, third-party resources, in order to make sure we're accurately entering the home medication history on our patients. The medication history is started by the nursing or pharmacy department in any area, emergency, ICU, outpatient services, etc. It should be completed within 4 hours of arrival into the facility. Some of the common symbols within the med history are a scroll icon, which equals a home medication, and a pill bottle, which is a medication that is a home medication but was recently prescribed on a previous visit. The staff member who is completing the home medication history is required to review and complete the following areas to their fullest extent in order to ensure an accurate and historical record for the physician to have in order to reconcile the home med. These include the medication name, the dose, the route, the last dose date and time, and the compliance from the patient. As a review from Lesson 4, should a patient not have any home medications or you are unable to obtain the information, you need to be selecting the boxes in the upper center of the screen under Medication History. The nurse and our pharmacist also needs to include a patient pharmacy. Here I want to pause just for a moment and discuss the patient-preferred pharmacy. What we did not cover in lesson number 4 on the adult admission history was that when in the document medication by history process, there is actually a link to the patient pharmacy. So those showed accessing patient pharmacy outside of the adult history, you can save yourself time by selecting this link during the process of reviewing the home meds and entering home medications while performing the adult admission history. For more information on adding a patient pharmacy, please go back to the end of lesson number 4. Next, let's briefly discuss the external RX history button. Many nurses utilize the external RX history to obtain historical home medications. Please be mindful to the following if you choose to use this tool. 1. The external RX is not to be used as a replacement for patient-family communication of home med history. Number 2, external RX is meant to be utilized as a tool or method for pulling in prescribed medications. Number 3, the user who pulls these in still needs to discuss these with the patient and or family member for accuracy. And number 4, the user is required to review the data if imported for accuracy and complete all sections, including the compliance and the last dose date and times. Another option, which is discussed in a separate video lesson, is the longitudinal patient record and the attaining of home medication histories from shared outside records. Here we see an example of a home medication history. Notice you have 2 home meds represented by the scroll icons. You also have one medication that is a home med, but it wasn't from a list or pulled in from a third-party resource. Instead, it shows the icon of the pill bottle. This tells us that this was a prescription entered from a past medical history visit within our own electronic health record. A completed home med history will show as a green check mark under the reconciliation status. Let's dig into the actual chart. Here's the chart from the standpoint of immediately selecting the document medication by history icon. Notice we have home medications that were previously entered. These are historical, meaning they show up from a previous visit in the chart. Of note, the nurse needs to first and foremost review these medications present with the patient and our family member for accuracy. Patients often do not stay within the same organization for treatment, and these historical meds may not be the most current. You want to review the existing list before adding any new medications. Be careful not to enter any duplicates. Select the plus add button to add new home medication. Here's your search field for medications. Let's begin entering some home medication. Let's enter MISC, and you'll see meds with these letters in the listing. In this instance, the user is selecting metagesic. This is a smart search, so it's finding medications that contains the letters MISC in it, and you can see that metagesic does contain those letters. We've identified the first medication to select, and we want to select the medication structure with the closest match to the actual prescription that the patient takes. We've selected it, and you'll notice that the order catalog pulls the medication up by its generic name, and the brand name will be in parentheses. The search engine is still active, and we can add yet another home medication. The patient has pulled out a little blue diamond-shaped pill that she states is for blood pressure. We have no way of identifying it, but we can document this in the home med history by searching and selecting unknown home medication. You'll see the med of non-formulary medication has populated. We'll continue filling it out in just a moment. For now, we have yet another home medication that we want to add. Let's search for Lipitor. Now let's select Lipitor 10 milligrams oral tablets, 1 tab oral daily. We're finished adding the medications, so we'll need to select the Done button. The pop-up box goes away. Now we need to review the data and the details for accuracy, and then we need to add a compliance to the medication. Select the Compliance tab. Here we have 3 areas of documentation. Defaulting under Status, still taken as prescribed. Information source defaults to Patient. And then there's the last dose date and time, which is blank. Selecting the drop-down button on status gives us the choices to choose from. The last dose date and time has an interesting feature in its selections. You can type T for today, and today's date will show. Utilizing the up or down button will move dates forward or backward, or you can select the larger down button to pull up a calendar. The time column utilizes a feature of typing in for now, and the current time will populate. Of note, on the time, this doesn't have to be an exact time. If the patient says, "I took the medication this morning," the nurse is free to select 0900 as the time will be approximate on recording. Notice on the medication how it lines up top that the compliance, date and time, and status is filled in. You can see which medications are missing a recorded compliance. Selecting on the non-formulary medication, you'll see the details data in the lower half of the screen changes. This data is blank because there was no pre-selected order details. Each section has a drop-down where you find more data, and if we select on it, we get the most common choices to choose from. Never free text data into these fields. Select Order Comments, and we can enter the data that the patient has told us about this unknown medication. Notice that the data we entered shows up on the details line in the home medication list above. We now move to the metagesic medication, and here, if we needed to, we can adjust the order details by utilizing available selections to make changes to accurately record the patient's home medication. We didn't demonstrate it, but if you know how a detail is listed in the system, we could have started typing that selection and it would narrow the searches available to choose from. Let's enter to compliance for this medication. Oops, we forgot to add a compliance on that unknown home medication. Let's go back and add it. In reviewing the historical home medications listed with the patient told us that they were no longer taking Reglan. So we need to remove it from this list. Select Reglan and it will highlight blue. Right-click on the medication and you'll get options. By choosing Complete, this will place the historical home medication in a completed status, and when the discharge paperwork is later given to the patient, this medication will not show up in an active range. You will see the medication move down to the pending home medication section, and it will state complete and have a line through it. Now we want to enter the compliance in for all of the remaining home medications. We can do this quickly by clicking on the first medication and dragging our mouse cursor to the last medication and releasing. Or you could select the first medication, hold the Shift key down, and then select the last medication to do the same thing. You will see that all of the medications are now highlighted blue. You would want to do this if all of the patient compliances were the same. Right-click on any of the highlighted medications. Select the pop-up Add Modify Compliance and complete the process. You'll notice that all of the medications are adjusted with the compliance that we just entered. Upon reviewing, I see that the compliance time for last dose is wrong on the potassium. It should read 2100, not 0900. We can fix that now. The home medication history is now complete, and we will select the Complete Medication History button. Notice on the reconciliation status for meds history, it now shows as completed with the green check mark. We can review the medication history documentation by looking in the view pane and selecting the plus mark next to medication history to expand it out. This information on last documented on appears, and if we select it, we can review the documented information. We've demonstrated the process of entering a home medication history, so now let's review the specifics of obtaining a home medication history. Documenting the medication by history, or home meds, is an admission requirement on all patients entering the hospital regardless of their location. This includes the emergency room, outpatient areas such as same-day surgery and outpatient radiology, in addition to inpatient and observation patients. At most hospitals, including our market, it is the nurse's responsibility to obtain the list of medications the patient takes at home. The provider is not able to reconcile the admission medications until the nurse has placed these in the document medication by history. While most nurses capture home medications, we are making several errors. Audit reviews on entering home medication history have shown commonly occurring errors that could cause patient safety issues. We'll discuss these over the next few moments. Error number 1 is duplicates. Before inserting any new home medications, always review the existing listed medication for accuracy. Duplicates cause extra time for sorting by the physician and can potentially overdose a patient if the duplicate is reordered and not detected. It's happened before, and if we don't review the listed medications and go straight to entering home medications, it'll continue to happen. Remember, the documentation medication by history is historical, meaning it retains information from the last admission or discharge. Here's an example of a home medication history where the nurse didn't review the historical home medications before entering the new list of home medications. You'll notice that there were historical home medications of Reglan and Lasix. To remove our duplicates, select on each duplicate that you want to remove and then right-click. You'll want to select Void to remove the duplicate and enter the reason of duplicate. Using Cancel DC or Complete will cause this duplicate medication to appear on the discharge summary that is presented to the patient as instructions upon returning to home. Our next common error that occurs on home medication histories is selecting wrong drug sentences. You should always select a pre-built order sentence whenever it is possible and adjust that sentence to be correct to the patient's home medication. Selecting a med name with no dose, route, or frequency pre-built and then filling in the responses causes patient safety errors when the physician reconciles the medication and an incomplete status. That incomplete status requires the pharmacist to research and make modifications to the continued home medications once the physician reconciles it. Only on extremely rare instances should you select none on an order sentence. An example would be an unknown or non-formulary medication. As the example shows, try not to select the name of the medication. Instead, select the drug with the dosage closest to the home med, then select the closest order sentence and adjust accordingly. When adjusting, always find an available selection from the pre-built selections. If you free text, the status will switch to an incomplete one when reconciling. Our third error, forgetting or ignoring compliances. If possible, you should be documenting the patient's compliance on all medications. Besides being required by federal agencies and insurance companies, it also allows the pharmacist to review the last dose, date, time, and schedule the medication appropriately when ordered. Our fourth common error is not removing medications the patient is no longer taking. We've discussed that the home med list is historical with that data crossing for previous visits. The nurse will need to clean up medications that the patient is no longer taking. In fact, you need to be completing out medications that are no longer relevant to the patient. We discussed this in the actual demo, but this is just a screenshot reminding you that you would right-click and select Complete on any medications the patient is no longer taking. One of the worst errors is error number 5, lack of addressing or reviewing home medications at all. Several audits show that the ER nurses are selecting no known home meds when addressing them in their workflow. More audits show that if a nurse sees the green check mark in the reconciliation status upon receiving a patient from the ER, they're not going back and verifying with the patient that the history is correct. Other audits show that nurses, when selecting unable to obtain info, are not relaying this message in bedside handoff, so the oncoming nurse can again address the lack of medications. Failure to identify home medications can potentially harm the patient by missed medications that would be detrimental to the care of the patient, causing at worst death, at least extended days in the hospital. Each of the bulleted points delays the physician from completing their admission medication reconciliation within 24 hours from the time of admission. The last common error is the error of omission. This is the process whereby a healthcare personnel identifies that a patient has an existing medical condition, say diabetes, hypertension, glaucoma, but fails to identify any medications that the patient is taking for this medical condition. This typically happens because a patient may fail to tell you they are taking eye drops for glaucoma, and this information wasn't given by the patient when the nurse was collecting the home meds history. Then the nurse gets to the pre-existing problems in the adult admission history fields, and the patient states, "I have glaucoma." When he asks them what they take for it, they pull out their eye drops from their purse and say, "These." The healthcare personnel needs to identify and verify the medications being taken for any of the existing medical conditions that are present. You've reached the end of Lesson 5, Med History Part 1. Please continue to Part 2 for the completion of the Med History lesson.